Welcome to Moments That Matter, a podcast that looks at the moments in our lives that come along from time to time that have consequences long after the moment, especially those moments that have to do with the choice of vocation. In his book, Let Your Life Speak, Listening for the Voice of Vocation, Parker Palmer speaks of a clearness committee in the Quaker tradition, wherein a group of older, wiser people ask questions of someone considering a life choice, as a way of clarifying the next step. We may not meet with a committee about these big decisions, but we all have these critical junctures in our lives which we can think of as clearness committee moments. We need to pay attention to these moments because they are profound and potentially life-altering. We will relay stories from our lives and interview others about theirs, especially noting the clearness committee moments, those we chose to recognize and those that were sadly ignored, those decisions that were made with God in mind and those that were not. Our hope is that these podcasts will cause you to think of the same kind of moments in your life with new clarity. Well, we are so fortunate today to have joining us in this special broadcast edition, Teresa Williams. She went to med school at UAB and added, while she was there, 1 year onto that for her Master's of Public Health, and then came to GHS for her residency and is board certified in internal medicine and pediatrics, and now works as a hospitalist here in the upstate. She has a heart for missions. She has been on the mission field in a number of different locations, specifically has a passion for training native doctors to work within their own contexts. And that's actually how our paths crossed. We met June the 22nd, 2005 on the mission field, and subsequently fell in love and got married and had kids. And maybe that's another podcast in and of itself. But Teresa, so good to have you with us today. Thank you for coming on.
Sure. Thank you for having me.
I would love to get your thoughts about this special broadcast edition about COVID-19.
Yeah, so certainly a hot topic. I think everywhere we go, that's what we're hearing. So I'll just tell you a little bit about my personal experience. So I, as Scott mentioned, work as a hospitalist. So that means that I see patients in the hospital, and because I'm certified in both pediatrics and internal medicine, I'm caring for babies that are just born, I'm caring for children, and then I'm also caring for adults. So I'm seeing people across the spectrum. And as you, I'm sure, are aware, this virus is affecting people across the spectrum. So it's certainly pertinent to what I'm seeing and doing, and am currently coming in contact with it pretty much every day that I'm at work these days. So it's certainly something that has rocked us in the healthcare system, and I'm sure lots of people have lots of concerns and questions about it.
Yeah, so I think one of the things we'll try to do today is dispel some common myths, and also as information continues to come out and evolve with this crisis, maybe see where things are going with our latest updates. But maybe you could tell us a little bit about what coronaviruses are and what makes COVID-19 different from what already has been in existence.
Sure. So viruses certainly are ubiquitous. They are everywhere. Coronavirus is a whole family of respiratory viruses. So traditionally, in medical school, I was taught about coronavirus being, it's an RNA virus for those of you that are scientific. And it, as I'm sure you have seen, it gets its name because it has sort of a crown-like appearance. That's what the word corona means. Generally, this virus is thought of as one that typically causes just normal cold symptoms. But there have been some viruses in the past that have come from this family, particularly the SARS virus back in 2002. And then there is another virus called the MERS virus that is still causing some sporadic infections that have been certainly more severe than the typical cold. These viruses have been thought to have initially infected birds, and the SARS-CoV-2 virus, which is the virus that causes COVID-19, is suspected to have come initially from bats and has caused worsening infection in humans because it's just something that our immune system is not traditionally seen, and therefore immunity in humans is much, much lower than it is to traditional coronaviruses. Therefore, it's causing much more severe infection.
And that's what's meant by a novel virus, that it's not been around in this specific mutation before.
Correct.
Gotcha.
So it's just something that our bodies don't have natural immunity to. So it's causing worse symptoms.
Gotcha.
And in terms of like the beginning, like of all of this, going back to ground zero in Wuhan, am I understanding correctly? You had mentioned the bats, about that this is basically from an animal market and somehow was ingested by a human being and then spread to other human beings. I mean, is that sort of the accepted story these days?
Yeah, I think there's still a lot of information that we don't know about where exactly it came from, and we're still understanding how it spread, but it certainly is believed that it initiated, like you said, near a market that has somehow, it's a virus that's mutated from a bat population and has changed so that humans can contract it and can certainly spread it to one another. We know that for sure.
You mentioned RNA. You're going to have to just give us a moment that matters on RNA versus DNA.
So basically, it just means it's just the kind of genetic material that it comes from. RNA is kind of the building blocks of DNA. So that's just what the cell uses to create the DNA. But that's just the kind of virus that it is. It really doesn't make much of a difference from a general standpoint, other than just the types of medications that we use to treat it.
Okay.
Here's what I think is interesting, and you've mentioned this before to me. A virus is not specifically a living entity like bacteria, but more of a sort of coded genetic something that can replicate in the body. Is that right?
Correct. So a virus, unlike bacteria, cannot replicate on its own. So a bacteria living in a petri dish can keep propagating itself. So it's a living organism. A virus is not living. It has to use your cell's genetic material. It basically hijacks your body and uses your cells to replicate itself. That's
crazy. So can it exist outside of a body for a time frame that is then still infectious enough that somebody else catches it, but it specifically itself is not alive? It's just hijacked things in your body to spread to other people.
Exactly. So there is certainly a lot of concern about it living on surfaces and whether that's a way that you can contract the disease. And they have done some studies that have shown that it does hang around on certain surfaces, and depending on whether it's cloth or plastic, it can live. I think they found up to like 10 days. So that's why the recommendation for cleaning surfaces. I think they haven't yet proven that somebody could actually contract the disease that way. We do know the virus hangs around that long, but it's certainly a theoretical possibility. So that's why it's important to wash your hands and to avoid touching surfaces that sick people might have touched.
So this is a season for people in the world of public health. It's like they're 100% on right now. This is what you live for. This is what you wait for. How do you see things from a perspective of public health when you consider large populations of people? What does this look like from your perspective with your background in public health?
Well, I think this is certainly where public health officials have come to the forefront and are saying things that we've been saying to people for years, that we know that viruses are spread by people being in close contact with one another, by coughing on one another, sneezing on one another, and that basic things that you were taught from childhood, washing your hands, avoiding touching your face, are going to be really important to mitigating the spread of the virus.
What do you see as the biggest gap between the medical understanding of what's going on and, say, the political or economic understanding of what's going on?
Yeah, so I think it's certainly a very tough position to be in. I certainly would not want to be one of the politicians having to make a choice between, do we worry about the health of our population or do we worry about the economic effects that it's going to have? I certainly think this is an unprecedented time in our history and something that we as a current population have never faced before. So as far as the virus goes from a medical standpoint, I think one of the misunderstandings, at least initially, was that this is a virus that was only affecting older, sicker individuals, and that children and younger adults weren't really being affected. And so I think at least initially that was causing people to just ignore a lot of the recommendations. And now we're starting to see that certainly children can get it. And despite some of the earlier reports from China, we're seeing children getting sicker than we thought that they might. Certainly not in the same numbers as adults, but it does happen. And also with our younger adults, there are some young adults with no underlying medical history who are ending up very sick and in the ICU. As I was reading a statistic from Johns Hopkins that about 12% of those in the ICU are between the ages of 20 and 44. And those generally are people who don't necessarily have other underlying conditions. So I think the important thing for the public to understand is that this is very serious and is something that unfortunately can affect anybody. It's hard to predict who's going to get very sick. We've seen some people who you would think would end up in the ICU do fine, and then other people who have no issues get very sick and die, unfortunately.
So you had mentioned about hands. That's like, something I think that most everybody can understand. I have to admit to you, though, that the whole idea of self-isolation and kind of sheltering in place, that has either been recommended or enforced now in a lot of different places seems pretty primitive in terms of a preventative. Is that a result of me not knowing, something that I should know, or is it a result of how little we know about the coronavirus, or how unprepared we were to deal with it? Or, maybe you could just kind of clarify that for me.
Sure. So I think the biggest issue is basically just trying to spread out the infections. And so, we know that our healthcare system has only so much capacity to take care of people as they get sick. And people may not know that a lot of times our hospitals are already running at near capacity. As a hospitalist, it's not uncommon for our hospital or surrounding hospitals to be full. And so if that's already the situation, and then you add on a pandemic in the midst of that, then you are definitely at risk of overwhelming the existing resources. So trying to spread out the amount of infection, there has been prediction that as many as 70% of people are going to get infected. If we can take that number and spread it out over 6 months rather than having it happen all in 1 month, then we have a much greater chance of being able to treat those people, potentially to have better treatments, as the medical community is working at a breakneck speed to try and come up with treatments and vaccines, and just allowing our healthcare system to have the resources available to care for them. So I think that is the biggest push that has come from this shelter in place and social distancing protocols that healthcare professionals have been calling for. And I think too, there are still lots of unknowns about the virus. So most of the data we have come from very small studies. Unfortunately, I think people don't understand it's just not possible with the speed at which this virus has affected the world to really have good data. And so there's just so much that's unknown. We still don't have a very good understanding exactly of how it spread. And so we're trying to go with the highest level of protection for our healthcare providers, for our patients, just in case there's something that we're not quite understanding. So I think it's just a lot of the fear of the unknown and trying to do the best we can with the information that we have.
Paul brings up a great point with this flattening out of the curve. So in essence, what you're saying is that flattening out the curve doesn't necessarily mean our infections will be lower in a really pronounced way. It's just spreading out the load over a certain amount of time. Does that, in essence, buy us a little bit more time when we're talking about working on therapies and immunizations and that sort of thing?
Definitely. I think at this point, I'm seeing things come out of the medical community with research, with the FDA approving things much faster than they typically would, with medications that people are attempting. I think there is certainly a lot of hope for potential treatments or therapies. And so as we get further into this, the more information we'll have, potentially the more treatments and or vaccine we might have available. So if we can spread out that infection rate, then people have a much better chance of doing better later on.
And if we use a term like cure, is that a term that would be used in this situation, or is it more treatment issues and maybe vaccinations down the road?
I think it's more likely to be treatment. Unfortunately, as people are starting to understand viruses, there are just not a lot of good medications that we've ever had traditionally to treat viruses. Viruses are things like HIV, like hepatitis. There have been some treatments that have come out with more serious viruses like that. But, in general, when you're talking about the common cold, there's never really been a good treatment for that. And so I think, cure for that. And so a lot of therapies have been more supportive, but if we can find things that we can use to help people who are getting very seriously ill, or at least come up with protocols that will help guide therapy as we understand more about how this virus affects people when they become seriously ill, then I think, again, the medical community will have much better success in treating these people.
So it sounds like you're saying there's no magic bullet right now for what we're dealing with. The treatment options we have heard a little bit about in the news, are there some that have some promise early on, even if it's anecdotally?
Yeah, so I think a lot of the information we have, unfortunately, right now is anecdotal. I was looking up, and hydroxychloroquine and azithromycin are a couple of the medicines that have gotten a lot of press and a lot of attention. And the studies with those were actually done in very small groups of people. So 30 to 20 were the different numbers that I was looking at. So only a couple of studies. I think the reason that we've been using those medicines are that they've been around for a long time. We have a great understanding of how they affect the body, and there are not a ton of side effects. And so at this point, we're basically just trying whatever we can, with the idea that the benefit likely outweighs the risk, but there's not a lot of good data that it's a magic bullet or that it's really going to make a huge difference. But at least we're trying something, and it makes us feel better as healthcare providers to be doing whatever we can.
And even when we're talking immunization down the road, is there a chance that they will find a viral sort of immunization, or will this be something that will help mitigate the secondary issues that come with the virus?
No, I think there certainly is some hope that we'll have a vaccine in the future. The flu is also a virus, and we have vaccines for those every year. And, there are certainly viruses that in the past have actually been completely wiped out through the use of vaccines. So I do think that there is some hope there. I think a lot of it will depend on whether this virus has any mutation or changes over time. Because that's part of the reason that the flu vaccine has to be repeated every year. There are changes in that virus. But I think we just don't know at this point what's going to happen in the future with this new coronavirus.
And speaking of flu, your response to coronavirus is just a bad flu would be?
I think, as opposed to the flu, where we can generally predict who's going to get very sick. And again, we have treatment for that. We have medications that work against the flu. We have immunizations to try and prevent the flu. This coronavirus right now doesn't have either of those. And like I mentioned earlier, there's just not a lot of ways to predict who's going to get severely affected by it. And so I know for my own partners, a lot of us are nervous because you can be perfectly healthy one day and then end up very, very sick the next. And so I think that is certainly a bit more worrisome and a bit harder to deal with as a healthcare provider, not knowing and not being able to predict who's going to get very, very sick.
Is there a way to look at, kind of SARS and MERS and the history there and the progress or lack of it in vaccines and, and ultimately potentially cures to understand kind of how things might go with COVID-19?
Yeah, so I did a little bit of research into the SARS outbreak and the MERS outbreak at the very beginning of this. And certainly those are a little different. They were much smaller populations that were affected. SARS was pretty much wiped out after 8 months. And I honestly am not sure exactly, other than just strict quarantining, how the government really was able to accomplish that. MERS is still around, but I think the difference seems to be that this virus tends to be much more transmittable than the other viruses. And so I think that's why the infection rates are much higher. And now we're certainly at a global scale. So we're in a different situation. I believe some of the medications, some of the antiviral medicines that are currently being tried are some that were initially looked at during the original SARS outbreak, because this virus is very similar. So there are people who are trying to use some of the information that we had back then to predict how this virus is going to act and potentially treatment modalities.
So is there any reason to be optimistic?
I certainly think there is reason to be optimistic. I think we have, there's so much collaboration happening within the healthcare community, unlike anything I've ever seen before. There are doctors that are constantly talking and communicating and trying to get as much information out there as possible, again, in ways that I have never experienced before. So I think there's certainly a lot of information that's going around, and there are a lot of very smart people who are spending all of their time thinking about this. And I think that we're going to see some positive changes from this in the end.
Okay. And this got a little bit personal for you on Monday, it seems, because suddenly there was at least the possibility that this was going to be part of your life because of having to treat people the way you do. And so can you give us just a little bit of background on that?
Sure. So again, as I mentioned, I'm a hospitalist. So right now I'm seeing patients. Potentially any patient that I see could have it, especially with the infection rates rising here in South Carolina. And I had a patient this past week who I had been taking care of for 3 days, who was not under precautions, who ended up spiking a fever and having some suspicion that he might be infected. And so while we were waiting on that test, I was trying to quarantine myself away from my family. And I think that's going to become a more and more common scenario with healthcare providers as we are interacting with people. And again, as the infection rates rise, that there's the potential that anybody you interact with could have it. And so just trying to make sure that I'm not being part of the problem by spreading it to other people. And it's certainly very difficult to be at home and try and not touch my daughters, not sleeping in a different room, trying to avoid touching any surfaces, making sure I'm washing my hands really frequently, because I don't want to be somebody who's an asymptomatic carrier that then passes it on to someone else. And unfortunately, again, I think it's going to become more and more common. And so we are going to have to find ways to try and keep ourselves sane as we just realize that sometimes things are out of our control, and we just have to pray and know that God protects our families and protects us, and just do the best we can with the information that we have.
What would be one thing that you would wish listeners would know about coronavirus that they probably don't already know?
I think the biggest thing is just what I've already mentioned, that we don't really know who's going to get really sick. Now that, 80% of people do just fine, and they have mild symptoms, or they don't really have many symptoms at all. So I don't want to make an alarmist statement by saying we don't know who's going to get really sick. I mean, there's certainly lots of people who do just fine. But I think the importance of that is just to really take the recommendations seriously, to try and make sure you wash your hands, avoid touching your face, avoid being around people when it's not necessary, so that we can hopefully spread out and lessen the amount of infections that we're having, to give our healthcare system the chance that it needs to treat the patients who are really sick, and just try and do your part. I know we talk a lot about the people who are on the front line, and there are a lot of us, but I think it's also important to recognize the people who are really doing their part by staying at home and not getting bogged down in it, not watching the news 24/7, taking time to really enjoy time with your family, and enjoy some of the positive aspects of being together with family at home while you're well and you have good health. And again, trying not to be overwhelmed by it, but also take it seriously.
I thought this was neat. You mentioned the other day, could we talk ventilators for a second? So we hear a lot in the news about need more ventilators, and they're having to be moved from one location to another. And we have production lines going into overdrive trying to create more. What's the story with the ventilator? Why are they needed?
So a ventilator, for those of you who don't know what that word means, it's basically a breathing machine. So these patients that are getting very sick are developing respiratory failure, and they get to a point where they can't breathe on their own, and they need a machine to help them do that. with this virus, we are seeing that people are needing that sort of treatment for longer than a typical flu or pneumonia, where they might be on a ventilator machine for a couple of days and then be able to come off. We're seeing patients stay on ventilators for 10 to 14 days. So a much more prolonged course. And so once a person gets sick and gets put on that ventilator, then it of course is out of commission for any other patients. And so as we see people come into the hospital and become very ill, then they may potentially require that sort of therapy. And so that's why it's important to have those machines, so that hopefully we're not having to make the really tough decision about whether somebody is going to survive and therefore should be put on that machine, or somebody who's already too sick that unfortunately, hopefully I never have to make this decision, but unfortunately saying that somebody may be too sick to use up that resource. And that's one of the tough decisions that they're starting to have to make in these places where the system is already being overwhelmed. So that's the reason behind wanting to try and make more, again, so that nobody ever has to make that unfortunate decision.
And you mentioned this, I thought this was very interesting, where they're able to use one ventilator for more than one person. Could you speak to that?
Sure. So, there are traditional ventilators, there are CPAP and BiPAP machines, which are just different kind of lower level breathing machines that we can utilize and convert to use in ways that we haven't traditionally used them in the hospital for patients who might need them. And then there are even people who've come up with different devices that have allowed you to utilize the machinery to basically divert the circuit so that air is going to different patients. So even here in the upstate, we've had some physicians come together who've created a device that can be used to have 4 patients on one ventilator. Now, I don't understand the specifics of exactly how that would look, and it's not something right now that we're having to use, thankfully, but we at least have some options if we get to that point.
Yeah, that's amazing. Let's put a positive spin on some of this. Where do you see this taking the medical world going forward once this is wiped out and we go on with our daily lives? Where do you see the medical world going with this?
Sure. So I know we talk a lot on your podcast about moments that matter, and I think this certainly is a moment for our entire civilization that is going to change things going forward. And so specifically for the medical community, there have been a lot of positives that I have seen. I've seen collaboration among physicians, like I mentioned, that's happened in ways that I've never experienced before. I've been invited to Facebook groups where there are hundreds of thousands of physicians that are communicating all the time about things that they're seeing and doing and asking each other questions and getting answers. And just a general solidarity among the healthcare community and just among civilization as a whole, that we're all in this together. We have this common enemy that we're trying to fight. And so coming together in ways that has just never really happened before. I also have seen innovations come about at speeds that have never happened before. So like I mentioned, these physicians in the upstate who created this device that will allow you to utilize one ventilator for 4 patients, having different therapies being at least attempted, and having information about what might be working with patients around the world and having that information shared has just been amazing to watch how people are coming together. And then in general, just from a public health standpoint, having people really get a greater understanding of how infection as a whole is spread. We've been trying to say this for years, decades, that it's important to wash your hands. It's important to avoid people when they're sick. And just a greater understanding that that is so important in mitigating infection. And one thing that I encounter a lot is that there's a lot of misunderstanding between bacterial infections and viral infections just in general in the community. And I think now that we've got this virus that has come to the forefront, that people start to understand that antibiotics, the way we traditionally think about them, treat bacterial infections. They do not work for viral infections. So whenever you, for instance, take your child to the pediatrician and they say, oh, it's a viral infection, here are some treatments that you can try, as far as just making sure that their nose is clean and making sure that they're working on, medicine for fever, but there's not a medicine I can give you that's going to fix the underlying infection. just a general public understanding of those big categories of infection and how they're typically treated, I think will be a positive moving forward for us as a society. And I think just in general, physicians starting to just understand that we are not in this fight alone, meaning, we've got each other, but we also have God that's in charge of this whole thing. And I know that I cannot go in my own knowledge, because knowledge is changing on an hourly basis about this virus. And so if I were to just depend on myself, then I certainly know that I'm going to fail in fighting this. But if I understand that God knows everything there is to know about coronavirus, and if I allow him to help me treat these patients with compassion, because sometimes that's the best we can do, then I'm going to be much more successful.
That's good. How about this? Just shooting from the hip, where do you see the world moving, the population moving? We've not seen anything like this, certainly in probably a century since the Spanish flu, the early 1900s. Where does the global population move forward from this?
Yeah, so I certainly think this is going to be a turning point in society. We're always going to remember the days of COVID-19, hopefully in a positive way as we see positive change. But I think society as a whole, hopefully we'll have a better understanding of the importance of family as we're starting to spend more time together in our homes and away from others. Hopefully there will also be just a greater understanding of what's really important. I know for me personally, trying to order something on Amazon and seeing, it's going to take a month instead of 2 days. Maybe I really don't need that. So just understanding what's really important, I think, will also be something that we'll see positively as we start to think more seriously about what's going on around us in the world. And in general, I just feel like this is, in a way, a bit of a reset button for us as society. So we're stepping back from the busyness of our daily lives, stepping back from the busyness of work, stepping back from all of the hustle and bustle of daily life as things are completely shut down, and starting to refocus on things that are truly important, and a reset for, even for our environment, as we're not having people travel as much anymore. And hopefully moving forward, we'll start to be able to put in place just a better focus on the most important things in life.
Well, it's been so nice to hear from you and to enjoy your wisdom as you have met with us today. And to our listeners, we thank you for listening, and Godspeed.